Why is discussing death difficult in African American families? Imagine sitting around a family table, sharing stories and laughter, but when the topic turns to death, everyone suddenly becomes quiet. Why is it so hard to talk about death in African American families? Let's explore this together. Many families hold strong spiritual beliefs that see death as part of God's plan. They believe that only God can decide when someone passes away. This can make planning for death or talking about it seem unnecessary or even disrespectful. People often hope for miracles or divine intervention, which can lead to avoiding honest conversations about end-of-life care. Family bonds are very important in African American communities. Families tend to be close-knit, with many relatives sharing caregiving roles. Decisions are often made together, informally, and sometimes just spoken aloud rather than written down. This makes formal discussions about advance directives or living wills less common. People might feel uncomfortable bringing up these topics because they prefer to handle things within the family circle. Historical experiences also play a role. Past discrimination and unfair treatment in hospitals have created mistrust of medical advice. Many African American families worry that doctors might not have their best interests at heart. This mistrust can make families hesitant to discuss hospice or palliative care options, fearing they might be pushed into treatments they do not want. Cultural values emphasize strength and resilience. Many believe showing vulnerability or grief openly is a sign of weakness. Men especially might avoid talking about death to protect loved ones from emotional pain. Instead, they focus on staying strong and supportive, which can make conversations about dying even harder. For elder care and grief support, providers need to be sensitive to these beliefs. It helps to include spiritual leaders or clergy in discussions. Respecting family decision-making and involving multiple relatives can make conversations easier. Building trust is key, so being honest, compassionate, and patient helps families feel comfortable. Framing advance care planning as an ongoing dialogue, not just a one-time task, encourages participation. Community and church-based education about hospice and palliative care can also clear up misconceptions. Understanding these cultural and social factors allows caregivers to support African American families better. When conversations are respectful and aligned with their values, families can make choices that truly reflected their wishes and beliefs.